particularly for the private folks that are.
So, yes, the advocacy community is engaged. We at PATH are the Secretariat for a group called the Global Health Technologies Coalition, which includes both private sector as well as public partners that are focused on the advancement of global health technologies. And so we engage, I think the membership is up to 35 organizations that are really looking at how do we look at innovative financing for R&D activities. How do we address common problems that are experienced by the different technology development partnerships, things like regulatory issues or clinical trials. And so there is a significant amount of advocacy work that's being done across sort of that private-public sector boundary.
And I would say from our perspective, we generally do not do the advocacy work, so we are dependent on our partners. And so absolutely, yes, that is a part of many of our partnerships.
As a representative of the Global Health Council, we run a lot of working groups and roundtables, and I think one of the things we are trying to do, and this is which is what I was so excited about this briefing today, is bring out more of these types of conversations, find out who's doing what, and I think try to foster great examples. And we did this on the Hill specifically to try to highlight first the positive roles of the private sector and the contributions that the private sector has been, and how the private sector has been engaged with these issues, but to also demonstrate these types of partnerships and trying to bring these best practices more and more. So those of you out there, if you have great examples, we'd love to collect them as we go around the Hill and talk about these types of partnerships more. There's we have time for a few more, yes.
Excuse me. I'm wondering how aware are the beneficiaries of the services they receive that are led or provided through public-private partnerships? And I ask because I'm wondering if that either helps or hinders the programs and services they receive.
I'll try. It sort of depends on who you define as the beneficiary. So if it's the children, for instance, who are receiving the vaccines, I don't think that they care who actually produced them. On the other hand, I think a number of the governments and the funders are interested in understanding how we can actually leverage this model to bring both a better, more efficient use of public resources and private resources. So the direct beneficiaries, I think, are primarily concerned with receiving whatever the intervention is that is being developed through that partnership. But I think the larger effect is a recognition that there are efficiencies and advantages to ensuring strong partnerships to deliver these kinds of, to both create and deliver these kinds of interventions.
Others, yes.
Yeah, question about leveraging private partnership, primarily in the developing countries, with emerging kind of private enterprise, private healthcare system, patent medicine vendors, all the other private sector that contributes to health, but also through regular economic development. How is USAID pushing more for not only the contribution of engagement of the local private sector, but contribution of financial resources and other resources into health development in country?
I'm not sure I have a complete answer for you. This is an area I'm starting to look into a lot more. I think it's a really important area for us to explore. I know that certainly with our public-private partnerships, we are trying to engage not just at the global level, but also at the country level, and engage private sector partners at the country level. But thinking about how we can use the tools that we have, whether they're existing tools or perhaps new tools, to be able to support these private sector enterprises and allow them to be more self-sustaining. So one mechanism that we do have is actually through the use of guarantees. So we have a whole guarantee arm that is working in a range of different areas. I think think in a former Soviet republic, we've used guarantees to be able to help encourage local investment, use the local banks to invest in the development of hospitals. And where the local banks may not come in, they may not be willing to take the risk to give loans to some of these private enterprises. But with a government-backed guarantee, we take a lot of that risk away. And so that we're basically leveraging the local banks and their resources by coming in and making it easier for them to make those loans, so those perhaps those private enterprises can start up or maybe move to the next level. So guarantees, that's an existing mechanism that we have that we've used in a number of different areas, and we are potentially looking to expand how we use those more creatively. There's a whole field of impact investing going beyond just micro enterprise loans that seems to be really taking off even just in the last few years, and has the potential to, I think, it's grown considerably, but it has the potential to truly take off, and that's one where looking to engage the resources of private investors to support more of these private enterprises in developing countries, and where we can try to leverage those resources, where those companies may be able to generate a return, and so attracting more money to invest in that area. So a number of different areas we're looking at, and I think a really important area to continue to pursue.
So one example that PATH was engaged in the mid-1990s was a program called PATH-CRH. Forgive me, I forget what the acronym stands for. But it was essentially a program where PATH provided technical assistance that was funded by USAID to companies who received loans from the ICICI Bank in India. And the purpose of the program was to transfer technologies from the US to Indian life science companies. Through that program, we transferred a number of diagnostic technologies that helped jumpstart the point-of-care diagnostics industry in India, as well as, I believe, other reproductive health technologies. And so that's a very specific example where USAID funded the PATH technical assistance. It was leveraged by the loans provided by the ICICI Bank in India, and it was all directed towards the development of sort of the life science industry in India.
Great. Well, if there aren't any questions, please join me in thanking our speakers this afternoon. I think you'll agree this was a very rich discussion today. I think really brought out a lot that I didn't know about public-private partnerships, and we really want to thank each of them for coming out, and again thanking our co-hosts, PATH and Management Sciences for Health, and all of you for sticking it through the 2 hours with us. Thanks a lot.